Hi everybody, welcome to Health Wanted, the place to be for healthy living. Today, we are going to talk about migraines, their causes, symptoms, and how to manage them. Migraines are more than just severe headaches. They are a complex neurological condition that can significantly impact an individual's quality of life. Affecting millions of people worldwide, migraines often come with debilitating symptoms such as intense, throbbing pain, nausea, sensitivity to light and sound, and sometimes visual disturbances. Despite their prevalence, migraines are often misunderstood and underdiagnosed. This video delves into the causes, symptoms, and effective management strategies for migraines. It provides a comprehensive overview to help sufferers and their loved ones better understand and cope with this challenging condition. Subscribe to our channel so that we can provide you with essential information to help you maintain good health and well-being. Let's now go to the video. What is a migraine? A migraine is a severe headache that causes throbbing, pulsing head pain on one side of your head. The headache phase of a migraine usually lasts at least 4 hours, but it can also last for days. This headache gets worse with physical activity, bright lights, loud noises, and strong odors. Migraines are disruptive. They can interfere with your daily routine and affect your ability to meet personal and social obligations. Treatment is available to help you manage migraines. What kinds of migraines are there? Migraines can be of several sorts. The most typical types of migraines are migraine with aura, classic migraine. Migraine without aura, common migraine. The stage of a migraine before the head pain starts is called an aura. Other types of migraines include migraines in children, abdominal migraine, chronic migraine, hemiplegic migraine, menstrual migraine, migraine without headache, silent migraine, retinal migraine, ocular migraine, status migrainosus. How common are migraines? Migraines are common. Studies show that an estimated 12% of people in the United States experience migraines. Symptoms and causes. What are the phases of a migraine? The 4 phases and common symptoms of a migraine are: prodrome. The first phase begins up to 24 hours before you experience a headache. Aura. An aura is a group of sensory, motor, and or speech symptoms that act as a warning sign of a migraine headache. The aura phase can last as long as 60 minutes or as little as 5. You might experience both the aura and the headache at the same time. Headache. A migraine headache lasts between 4 hours to 72 hours. Postdrome. The postdrome stage usually lasts for a few hours up to 48 hours. Symptoms feel similar to an alcohol-induced hangover, which is why the postdrome phase is known as a migraine hangover. It can take about 8 to 72 hours to go through the 4 stages. Migraine symptoms. They vary based on the stage. Every migraine is different, and you won't necessarily experience symptoms during all 4 stages of every migraine. Prodrome symptoms. Mood changes, difficulty concentrating, trouble sleeping, fatigue, nausea, increased hunger and thirst, frequent urination. Aura symptoms. Muscle weakness, vision changes, ringing in your ears, tinnitus, sensitivity to touch, feeling like someone is touching you, numbness and tingling, difficulty speaking or concentrating. Headache attack symptoms. Head pain gradually gets more intense. It can affect one side of your head or both. It can occur with other symptoms like nausea and vomiting. Light, sound and odor sensitivity. Postdrome symptoms. Fatigue, stiff neck, sensitivity to light and sound, difficulty concentrating, nausea, dizziness. What does a migraine feel like? Pain from a migraine headache may feel like this: throbbing, pulsing, pounding, dull. Everybody experiences a migraine differently. There are various severity levels for migraine headaches. One side of the head may hurt first, then the other. In addition, pain in the vicinity of your eyes or temples may occasionally radiate to your face, sinuses, jaw, or neck. How often do migraines happen? Each person experiences migraines at different frequencies. One migraine may occur once a year or once a week. Most people encounter 2 to 4 times a month on average. They occur most frequently in the morning. The majority of migraines are random, but occasionally, such as right before a period or right after experiencing stress, you may predict when one will occur. What causes a migraine? Although the precise etiology of migraines is unknown, research indicates that heredity may be a factor. Your brain receives pain signals from particular blood vessel nerves when you have a headache. This causes the blood vessels and nerves in your head to become inflamed. Your nerves do that for no apparent reason. What triggers a migraine? Something that sets off symptoms is called a trigger. Among the most typical migraine triggers are stress, alterations in hormones, certain drugs, alterations to your sleep patterns, the weather fluctuates, overindulgence in physical activities, addictive drugs, such as smoke or coffee, skipping a meal, exposure to strong smells, loud noises, or bright lights. You can find your triggers with the assistance of your healthcare provider. To monitor commonalities between migraine attacks, they can advise maintaining a migraine notebook. What foods trigger migraines? Certain chemicals and preservatives in food may cause sensitivities in your body. This sensitivity increases the likelihood of a migraine, particularly when paired with additional triggers. Among the most typical dietary triggers are cheese that has aged, drinks that have alcohol in them, cocoa, food additives such as MSG and nitrates, prepared or preserved foods, pepperoni, hot dogs, etc., pickled or fermented foods. Do migraines run in families? Indeed, migraineurs typically come from biological families. 80% of migraineurs have a first-degree biological relative who also suffers from the headache disorder. What are the migraine's risk factors? From toddlers to adults, anyone might get a migraine. The likelihood of experiencing a migraine is higher in women and those labeled as female at birth than in men and those identified as male at birth. There are additional risk factors that could increase your likelihood of having a migraine, such as migraines in the biological family history, epilepsy, anxiety, depression, sleep difficulties, usage of tobacco products on a regular basis. Diagnosis and tests. How is a migraine diagnosed? After doing a neurological and physical examination, a medical professional will identify a migraine. Your medical history and the health history of your biological family will also be further investigated. To find out more about your symptoms, your doctor might ask you the following questions. Which symptoms are you experiencing? What is the location and sensation of your headache? What was the duration of your symptoms? Has anything improved or made your headache worse? Blood tests and imaging tests, such as an MRI or CT scan, may also be prescribed by your doctor to rule out any other possible reasons for your headache. Your doctor may use an electroencephalogram, EEG, to rule out further conditions. Who diagnoses a migraine? Speak with your primary care physician, PCP, about your symptoms if you believe you are suffering from a migraine. They are able to identify migraines and begin treating them. Your PCP might recommend that you see a neurologist or headache specialist. Management and treatment. How is a migraine treated? Migraine is an incurable condition. Yet, a medical professional can assist you in controlling your migraine symptoms by doing the following: taking prescription drugs, avoiding things that can cause migraines, utilizing non-traditional migraine treatments. Which drugs are used to treat migraines? If you have migraines, your doctor may advise you to take medication. There are 2 categories of drugs available: medication to stop migraines. You can take these medications at the first sign of a migraine. They stop or reduce migraine symptoms like pain, nausea, sensitivity, and more. Medication to prevent migraines. preventive medication is typically prescribed by a healthcare physician if you suffer from severe symptoms that disrupt your daily routine or if you have migraines frequently. These drugs lessen the frequency and intensity of your migraine attacks. You can take these drugs as prescribed, usually once a day. Drugs are available in a variety of forms, such as a subcutaneous, under the skin, injection, an oral drug, ingested by mouth, a spray for the nose, via intravenously, or an IV. Suppository. Your doctor and you will talk about the exact drug combination, and formulation that will help you manage your symptoms the best. Use of all drugs must be supervised by a headache specialist or provider. It's crucial to carefully follow your provider's recommendations when taking any medication. Over-the-counter migraine medications. If your migraine symptoms are mild to severe, over-the-counter drugs can help. The primary components of drugs that relieve pain are aspirin, ibuprofen, acetaminophen, naproxen, and caffeine. When using over-the-counter pain medicines, exercise caution. Overuse can occasionally result in dependency issues or headaches associated with analgesic rebound. Inform your healthcare practitioner if you take over-the-counter painkillers more frequently than twice or 3 times a week. They might recommend prescription drugs that work better. Alternative treatments for migraines. To assist you manage your migraines, you might wish to consider alternative therapy. Among them are consuming certain vitamins, minerals, or herbs, such as coenzyme Q10, feverfew, butterbur, magnesium, or riboflavin, vitamin B2. Relaxation techniques. Biofeedback. Injections of type A botulinum toxin, Botox. Consult your physician before beginning any alternative migraine treatments. How do I deal with a migraine as it happens? Sleeping in a nice, quiet, and dark environment. Putting a washcloth or cold or warm compress behind your neck or on your forehead. Massaging your scalp. Circularly applying pressure to your temples. Keeping yourself in a calm state by meditating. A migraine is not like a headache, which you have probably experienced before. Sometimes it seems as though everything is ending and there is nothing you can do to stop it. Time seems to be against you and moving more slowly during the period of a migraine, even though your symptoms are just momentary. However, there are ways to treat migraines so they don't ruin your day by managing them as they happen. You can avoid having migraines take over your life by seeking assistance from a healthcare expert. That's all for today, and always remember to stay healthy. Subscribe to the channel to receive regular health tips and advice. Thanks for watching, and we'll see you in the next video.